Session 7 Public Health Policy in Nigeria. Introduction. In this lecture, we shall discuss the health services in Nigeria. To start with, we will examine the traditional healthcare system, and from this, we will move on to discuss the evolution of modern health services in Nigeria. This will be followed by a critical examination of the state of health services in Nigeria, as well as the philosophy guiding the national health policy. Objectives. At the end of this lecture, you should be able to 1. Explain the concept of health. 2. Discuss the concept public health policy. 3. Explain the traditional healthcare system. 4. Discuss the evolution of modern health services. 5. Explain the state of health services in Nigeria. And 6. Discuss the philosophy guiding national health policy. Pretest. 1. Explain the concept of health. 2. What do you understand by the concept of public health policy? 3. Briefly explain the traditional healthcare system. 4. Explain the evolution of modern health system in Nigeria. 5. Discuss the state of health system in Nigeria. And 6. Discuss the philosophy guiding the national health policy. An important component of socio-economic development in any society is good health. Good health is essential because it is a vital component of the quality of life as well as a prerequisite for high levels of productivity. We cannot overemphasize the importance of health in national development, as this itself has been recognized by governments, past and present, as crucial to overall national development. In fact, the national health policy stated above provides an eloquent testimony to the fact that the health of the Nigerian citizen is of primary importance to the government. No government can function if a sizable amount of its citizens are sick. In this lecture, we shall discuss the structure, management, spatial distribution, problems and policy issues relating to health services in Nigeria. But before we do this, it is appropriate to understand the concept of health. The World Health Organization, WHO, 1946, defines being healthy as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. When these conditions are not fulfilled, then one is said to be sick or ill. Medication and the science of pharmacology is used to cure or reduce symptoms of an illness or medical conditions. Developmental disability is a term used to describe severe, lifelong disabilities attributable to mental and/or physical impairments. For a better explanation, some concepts such as physical, mental, and social well-being should be further explained. As regards physical being, abnormal conditions of the body or mind that cause discomfort, dysfunction, or distress to the person afflicted or those in contact with the person can be deemed an illness. Sometimes, the term is used broadly to include injuries, disabilities, syndromes, infections, symptoms, deviant behaviors, and typical variations of structure and function, while in other contexts, these may be considered distinguishable categories. A pathogen or infectious agent is a biological agent that causes disease or illness to its host. A passenger virus is a virus that simply hitchhikes in the body of a person or infects the body without causing symptoms, illness, or disease. Foodborne illness or food poisoning is any illness resulting from the consumption of food contaminated with pathogenic bacteria, toxins, viruses, prions, or parasites. Furthermore, as regards mental being, mental illness or emotional disability, cognitive dysfunction is a broad generic label for a category of illnesses that may include affective or emotional instability, behavioral dysregulation, and/or cognitive dysfunction or impairment. Specific illnesses known as mental illnesses include major depression, generalized anxiety disorder, schizophrenia, and attention deficit hyperactivity disorder, to name a few. Mental illness can be of biological, e.g., anatomical, chemical, or genetic, or psychological, example, trauma or conflict origin. It can impair one's ability to work effectively or to go to school and engage in other meaningful, beneficial activities. Other generic names for mental illness include mental disorder, psychiatric disorder, psychological disorder, abnormal psychology, emotional disability, emotional problems, or behavior problem. The term insanity is used technically as a legal term. Brain damage may occur due to a wide range of conditions, illnesses, or injuries. As regards social being, social determinants of health are the social conditions in which people live that determine the status of their health. Illnesses are generally related to social, economic, political, and environmental circumstances. Social determinants of health have been recognized by several health organizations, such as the Public Health Agency of Canada and the World Health Organization, and these have motivated these agencies or organizations to greatly influence collective and personal well-being. Types of health systems in Nigeria. There are basically two distinct systems of healthcare in Nigeria: the traditional and the modern healthcare systems. The two systems are fundamentally different from each other, not only in terms of availability and quality of care, but also in terms of technology and social adaptability. However, there is a similar current flowing through both systems, especially as they aim to serve the same population in need. Thus, the two systems coexist, although they intentionally remain functionally unrelated. Of the two systems, the government often supports the modern system, which often assumes the character of a monopolistic medical establishment and a doctor-dependent, hospital-based healthcare model, and which often ignores the importance or desirability of the traditional system. We will attempt here to discuss the traditional health system because it is the one that appeared first and more in use, especially in rural areas, before discussing the specific structures of the modern health system. Traditional healthcare system. We can conceptualize the traditional healthcare system in Nigeria as any effort by any indigenous community to tackle the problem of illness and disease. It incorporates within its scope medical taxonomy, folk knowledge, guidelines, traditions and values, health behavior rules and patterns, supportive social institutions, and identified personnel, structures of delivery of preventive and restorative therapy. The detailed features of traditional healthcare systems vary from one part of Nigeria to another. This, in fact, reflects the varying socio-cultural characteristics of the people in different parts of the country. Despite this spatial pattern, however, traditional healthcare systems, by their characteristics, have basic commonalities. To start with, all healthcare begins with a fundamental perception of illness. The perception is made either by the patient or his associates, family, and friends. Also, reactions to symptomologies are culturally determined. Thus, the traditional concept of disease causation in Nigeria incorporates a belief in both natural and supernatural causative agents. Frequently, Nigerians will blame witches and wizards, ghosts, and other spirit beings for their illness. Also, they may locate the source of their health problems in breaches of taboos and failures to observe kinship rules or religious obligations. This conceptual base of the cause of illness and diseases in the first place will ultimately determine the nature and type or model of treatment to apply. The process of diagnosing the ailment also reflects the pattern identified for its treatment. Diagnosis is based on one or more of several procedures, including observation of the patient's attitudes, gestures, and ability to perform basic tasks as a test of logical reasoning. Divination and possession, which may lead beyond diagnosis to prognosis and prescribed treatment, and case history, which may be intensive and over a patient's family and social milieu. Traditional healers include herbalists, who primarily use herbs to practice healing, cult healers, who possess strong spiritual powers to negotiate or deal with witches and wizards, fetish priests, who depend on some deity, herbs, divination, and possession, and the leaders of synergetic churches, who use prayers and other ritualizations to heal sick members who possess the necessary amount of faith. Under the practice of traditional medicine, the sick have three basic options. First, to recover from the illness. Second, to remain sick. And third, to die. Traditional healers are seen as helping mediums who attempt to mediate the relationship of the sick and some hidden supernatural forces. The influence and efficacy of the methods of some Nigerian traditional healers are pervasive and transcend national boundaries. Many provide support for clients who come from so many other countries, including Western European countries and the Americas. Several of the important traditional medicine practitioners have also established clinics outside Nigeria in their attempt to extend healings outside the frontiers of Nigeria. In many rural areas in Nigeria, traditional medicine provides the only source of medical care as a result of the scarcity and low accessibility to modern medical services. In such environment, the use to which traditional medicine is put will vary intensively with the nature and seriousness of the ailment, the type of specialist customarily sought, the acculturation of the client, the proximity of a preferred or reputable specialist, and transportation. Also, in such cases, where modern health facilities can also be accessed in the rural community, preference for a particular healthcare provider, whether traditional or modern, will be determined solely by individual taste, which itself may be hinged on past experiences, the concept and definition of etiology, perceived chronicity, and expectations of a cure. The modern healthcare system. As regards modern health system in Nigeria, the modern health services of Nigeria have evolved through a series of historical developments, including a succession of policies and plans which had been introduced by previous administrations. The health services are judged to be unsatisfactory and inadequate in meeting the needs and demands of the public as reflected by the low state of health of the population. At this juncture, it is pertinent to attempt a historical analysis of the background of the growth and development of the health services in Nigeria. We shall also attempt an understanding of earlier attempts to formulate national policies on health and the present state of the health services. The policy proposed and the strategies emerging from it have been based on an appreciation of the current status of the health of the people of Nigeria, with a careful analysis of the major factors which affect the health of the population, as well as the nature of the intervention which can produce improvement most rapidly and economically. It is important to note that the public health services in Nigeria originated from the British Army Medical Services. With the integration of the Army with the colonial government during the colonial era, government offered to treat the local civil servants and their relatives, and eventually the local population living close to government stations. The Colonial Medical Service developed and was duty-bound to provide free medical treatment to the Army and the colonial service officers. Medical treatment which government initially provided its officials was made available to the local population only as an incidental service. Various religious bodies and private agencies established hospitals, dispensaries, and maternity centers in different parts of the country. The first attempt at planning ahead for the development of health services in Nigeria took place in 1946 as part of the exercise which produced the overall 10-year Plan for Development and Welfare 1946 to 1956, covering all aspects of governmental activities in the country. Since Nigeria was still a colonial territory, the proponents of this plan were mainly British officials. It included 24 major schemes designed to extend the work of existing government departments, although it was not an integrated development plan in the current sense of the word. These schemes were not economic targets. Nevertheless, it was modest, realistic, and it served as the basis for subsequent health plans. Since the country became independent in 1960, health policies have been initiated in various forms, either in the national development plans or as government decisions on specific health problems. Along this line, we can identify three distinctive periods. 1. The health component of the Second National Development Plan, 1970 to 1974, identified and aimed at correcting some of the deficiencies in the health services. 2. In the Third Development Plan, 1975 to 1980, there was a deliberate attempt to draw up a comprehensive national health policy dealing with such issues as health manpower development, the provision of comprehensive healthcare services based on the Basic Health Services Scheme, disease control, efficient utilization of health resources, medical research, health planning and management. 3. The health policy content of the Fourth National Development Plan, 1980 to 1985, will be the focus of this chapter. The state of the health services in Nigeria. As currently organized, the health services show major defects that are widely recognized. These include: 1. The coverage is inadequate. It is estimated that no more than 35% of the population has access to modern healthcare services. Rural communities and the urban poor are not well served. 2. The orientation of the services is inappropriate, with a disproportional high investment on curative services to the detriment of preventive services. 3. The management of the services often shows major weaknesses, resulting in waste and inefficiency, as shown by the failure to meet targets and goals. With different levels of government, voluntary organizations, and other agencies providing healthcare, the various inputs are poorly coordinated. Number 4. The involvement of the community is minimal at critical points in the decision-making process. Because the communities are not well informed on matters affecting their health, they are often unable to make rational choices. 5. The lack of basic health statistics is a major constraint at all stages of planning, monitoring, and evaluation of health services. 6. The financial resources allocated to the health services in Nigeria, especially to some priority areas, are inadequate to permit them to function effectively. 7. The basic infrastructure and logistics supports are often defective, owing to inadequate maintenance of buildings, medical equipment, and vehicles, unreliable supply of water and electricity, and the poor management of drugs, vaccines, and supply systems. 8. Whilst this list is an accurate summary of the broad range of defects in the health services in Nigeria, there are also encouraging cases in which dynamic health administrators, professional persons, and lay members of the community have successfully corrected these faults within their local areas. Such successful programs provide useful models of what can be done with limited resources in spite of various constraints. To achieve health for all Nigerians, the national health policy is based on the national philosophy of social justice and equity. A health system based on primary health care is adopted as the means of achieving the goal. The national philosophy. The national philosophy is founded on the principles of social justice and equity. This philosophy is clearly enunciated in the Second National Development Plan, 1970 to 1974, which described the 5 national objectives to make Nigeria: 1. A free and democratic society. 2. A just and egalitarian society. 3. A united, strong, and self-reliant nation. 4. A great and dynamic economy. And 5. A land of bright and full opportunities for all citizens. These principles of social justice and equity and the ideas of freedom and opportunity have been affirmed in the Constitution. The National Health Policy has been formulated within the context of these objectives. Furthermore, the formulation results from a strong belief in socio-economic development, that all sectors shall be mutually supportive and together contribute to the ultimate goals of the nation. Health development shall be seen not solely in humanitarian terms, but also in an essential component of the package of social and economic development, as well as being an instrument of social justice and national security. Study Session Summary. In this lecture, we have discussed health care services in Nigeria. We started by defining the concept of health using the World Health Organization definition. We also explained some vital components of that definition, which includes physical, mental, and social well-being. From this, we proceeded to discuss two types of healthcare systems in Nigeria, namely traditional and modern health services. We concluded this lecture by examining the state of health services in Nigeria, as well as the philosophy guiding the national health policy in Nigeria. That ends study session 7. Thank you for listening.